Hey, it's Dr. Ray with Olive Branch Wellness Center. Hey, I guess we're on to part 3 of digestion. So, we talked about the mouth, chewing, swallowing, amylase, for those of you who missed the first 2. Then we talked about how the stomach gushes up the food and uses hydrochloric acid and some of there's cells in there that help promote some of the secretions. Now we're going to talk about, remember we said at the last portion of the last video, we said we were going to experiment or give you some information on what happens next. Once food passes from the pyloric sphincter out of the stomach into the first half of the small intestine. That first half of the small intestine is called the duodenum. Now the duodenum is there to help break food down even further. And you're thinking, well, you already told me I chewed it up 20 to 30 times. I swallowed it, the stomach gushed it up into this juice. But things need to get broken down even further into a molecular state. So this is where some of the bigger nutrients are absorbed and utilized. And that's what we want to make sure that you can do. So when you're having problems in that state, you may have indigestion about 3 or 4 hours, maybe even 5 hours after you've eaten, or you can have some pain under the ribs, right in the middle there, and that V where the ribs are after you've eaten about 3 or 4 hours, and that might be an indication that you're starting to have some problems in your small intestine. And if we don't get things broken down properly in the stomach, the molecules are too big, the small intestine looks at it and goes, yeah, there's the calcium we need, and there it goes, it was too big, I can't break that up. So we want to make sure that you're digesting well, getting the nutrients you need from the small intestine, the first half, the duodenum. After there, it goes into the second half of the small intestine called the jejunum. Now the jejunum, more nutrients are exchanged. Some water begins to be pulled in and out, salts, biosalts, things like that. So again, if we're not chewing it up well, if we're not breaking it up well with our teeth, if we can't do it in the stomach, we're not getting the nutrients absorbed. But more importantly, with the small intestine, we might not have enough good bacteria to break that down. And we'll talk about that in our next part. Feel better today? See Dr. Ray.